And now it's time to welcome our speaker, Dr. Brittany Badal. Dr. Badal received her Bachelor of Science in Biology from the University of Central Florida, her medical degree from the University of Louisville, and completed her pediatric residency at Johns Hopkins All Children's Hospital. She then completed her fellowship at the University of California, San Francisco in adolescent medicine. She joined the faculty at the University of Louisville in 2021, where she serves as an assistant professor in pediatrics and clinical director of adolescent medicine. She has clinical interests in eating disorder care, addiction treatment, and reproductive health. Thank you for joining us today, Dr. Badal.
Hi, all. I am so thrilled to be back for part two of substance use care for adolescents today. Wonderful. Well, I'm going to go ahead and share my screen here. And so we can go ahead and jump on in. Okay. Well, thanks for that introduction, Dr. Cooper. Today, we're going to talk a little bit about hopefully some practical strategies to integrate into your clinical practice. Our main objectives today are to first describe strategies for initiating and really maintaining some open and non-judgmental conversation with teens about substance use, identify some tools and resources to hopefully support adolescents through substance use challenges and even identifying those, and really discuss common kind of psychiatric conditions that often accompanied substance use issues in teens and how to integrate that approach into treatment. So first off, really, let's talk about the power of communication, right? I think all of us at one point in our careers, or maybe even in our daily lives, can think about how intimidating it can sometimes be to talk to teenagers, right? And really, I think it's important to talk a little bit initially at the onset of your conversation about sharing rules around confidentiality, right? And so we all probably have our own strategy for how we talk about that with adolescent patients. But really being upfront and honest with them about like, hey, whatever you share today will stay between us unless I'm worried about your safety, right? I do like to keep that somewhat on the broad side when I have that conversation, and setting my own parameters for what I consider unsafe or safe behaviors. And really importance of establishing trust and creating that safe space for dialogue, and really using some active listening skills to understand kind of the team perspective. And today we're going to hopefully touch a little bit about some techniques of discussing risk and consequences when discussing substance use without trying to trigger that defensiveness. And, you know, I really just want to put out there is kind of this spectrum, right, of where kind of there's prevention, and we think about that in preventing the initial use or delaying use of any substance use, right, in adolescents. And we know that is so, so important for decreasing risk of substance use disorder over the course of someone's life. You know, the longer in someone's life they have until they try alcohol for the first time, try nicotine, try another substance, the decreased risk of substance use disorders later on there might be versus early onset use. So really that in pediatrics, that is our gold standards, right? We're trying to prevent. But we know that comes up for some teens. We think about this secondary, right? And this gets into the spectrum, tertiary next line of prevention and that harm reduction, and that it is kind of a spectrum for people, and thinking about early detection of substance use once things have already started, trying to reduce early on, and then really any tertiary kind of efforts we can take to reduce or further prevent health deterioration if they are using. So this is where I think it's really, really important to meet somebody where they are at. And sometimes when we're talking about substance use, we forget we are really skilled at this, right? We talk about seatbelt use, we talk about helmets, we talk about birth control, we talk about sunscreen, right? We talk about kind of meeting people where they're at in lots of different venues. And so I want you to think about those times that you use some motivational interviewing skills in these other capacities and how we can apply that to kind of talking with our teens about substance use behaviors. I know last time in part one, if you're able to join, we talked a little bit about substance use screenings. I'm very briefly going to touch on those today, but wanted to just kind of share some of the most popular and some of my favorite ones for initiating some screenings into my clinical practice. So we'll talk a little bit about these three tools: the CRAFT, the S2BI, and the BSTAT. And so really screening tools are the opportunity to give feedback to patients about how their substance use might be putting them at risk. And really an opportunity to educate teens and young people about ways to consider minimizing that risk, or even just congratulating them if they're not using, right? We talked about prevention. And so even saying like, wow, it sounds like you're making some really healthy choices, right? Avoiding substances. And that's really impressive. You should keep that up, right? And, thinking with our teens, when they're screening positive on some of these tools, you may want to focus on those impacts to their social functioning, on their family, their relationships, more often than just physical long-term health effects. Because as we can think about with teenagers, they don't always think like, oh, cancer is going to happen to me in 50 years, right? They're not really thinking about those ramifications for their health. And so I wanted to share a little bit about SBIRT, right? So this is screening and brief intervention or referral to treatment. And this really is phased in three ways. So the first piece is really that brief education. So sharing information with your patients about just the risks of substance use, right? And so most commonly, I feel like for teens, this comes up for like alcohol use, cannabis use. And so really sharing with them like, hey, like, what do you know are the risks to using this, right? Sometimes that can be an opportunity to open the door to have the conversation, or even talking about like, hey, driving under the influence, right? We always think about like the dangers with alcohol, what is your safe ride home? What if you have been drinking, let's not get in a car with someone that's been drinking. But also around cannabis use, right? That also decreases reaction times. And so talking with teens about that piece. This is where, it kind of goes into that brief intervention too, even just to kind of raise their awareness of what their substance use has looked like. And trying any which way to be like, reflect with them, right? Take that like 3 to 15 minutes in that initial screening to be like, oh, it sounds like you have, initially we're smoking, once a week, occasionally with friends, right? Maybe you had tried it once or twice over the school year. Now you're using like multiple times a week. That's interesting. Tell me more. Even getting to reflect with them back how things have changed, how maybe they're relying it on it a little bit more, a different substance that they weren't maybe have thought about, can be a really helpful way to have this conversation. And then really, if someone is using and it is really interfering with their ability to function in their day-to-day life, their personal relationships, their school performance, and they're ready for treatment, that's where referral can be a really proactive process. And even just offering is going to be really helpful for them. So whenever positive use comes up, the first step is always to remind them that not using at all is the safest option, right? I think we can all, understand that piece, right? Our goal for their ultimate health is abstaining from substances. But they either may be using substances or in a circumstance where their friends or peers are using. And so that's really where we have to kind of employ these other kind of risk reduction techniques and really meeting them where they are. And so when you're having these conversations, remember to keep it conversational. One thing I always like doing too is asking about the positives and the negatives of their use. And I think that surprises many of my teens when I say, well, why do you like using? Right. But sometimes that can be really telling, right? And so not uncommonly, someone will tell me they're using because it helps calm them down, right? It helps them deal with their anxiety, helps them sleep at nighttime. And so that always gives me an in to say, hey, you're really struggling with XYZ. Can we use like something that's like evidence-based to help with that? Can we talk about sleep hygiene? Can we talk about other strategies that may be more beneficial for your long-term health? And really asking what their negatives are, right? I think most of us are pretty familiar with motivational interviewing techniques. And so we're, just checking in about like, what do you not like about use? Has your use gotten in the way of you being on the basketball team or keeping your GPA up for different extracurriculars? Has it gotten in the way of you being on time for your job, right? Or getting in trouble with your family, getting in trouble with your parents, and getting in trouble legally in some capacity? So really understanding what those implications of their use have been for them. And then, always, I think I share with people, we know substance use is not helpful for our health. And my ultimate goal is, for you not to use. But if you're not ready for that, how can we set a goal to cut back? And that's really where we've all heard probably of like SMART goals, right? So I will try to work with my patient on, in that conversation to have, let's set a specific SMART goal, right? Let's make it specific, measurable, timely, relatable to what they need, and keep following up to check back in, to keep reassessing. And so I'll even like put that, in my note, being like, oh, this is the goal that we set this day. This is how confident they are about it. So I can really kind of check back in next time and be like, okay, well, you told me you were going to do X, Y, Z. How did that go? And have that line of communication open with them. I think this is always a good example, right? Most of my teens have, they we do a craft, right, on their screening tool. We see that they are a 5 on the craft. They have high risk factors for meeting criteria for a substance use disorder. And they are like, this is totally not a big deal, right? They identify that they are vaping cannabis and nicotine pretty regularly. They binge drink on the weekends, and occasionally will kind of try pills that their friends give them. But they don't think this is a big deal because everybody does this. So this is really where, you got to take a deep breath before you walk in that room, say, okay, I'm going to try to meet them where they're at today, but this is really concerning to me, right? And so acknowledging that at different times, people are going to feel more or less motivated to change, right? And sometimes they're ready for action to reduce harm, but they might be kind of in that pre-contemplative stage where they're like, right, okay, these things can be dangerous. How can I reduce my harm? But I'm not sure I want to or can kind of stop my use altogether. And so really just reminding them, right, there's different ways that we can still protect their health, and try to reduce some risky behaviors, even if they're not planning on quitting entirely. And so, things that I always try to do is steer that conversation, right? Like, where are you using? How are we staying safe if the adolescent themselves is using drugs? What if they're at a party, right? In a social situation, if friends are using and they want to help them in some ways, right? And I think this is always a good opportunity too, before you just totally dive right in, even just asking like, hey, I saw, your substance use screening, your craft score was on the higher side. I really wanted to talk about it today. Can we talk about your substance use? Can we talk about ways to keep you safe? I think it always feels intimidating to ask permission. And so I do want to highlight that probably 95+% of patients, when I ask them, like, hey, is it cool if we talk about this today? Say yes. Like they're fine to talk about it. And we know that sometimes asking that permission just better engages them in the conversation. Maybe they're less likely to feel defensive at the onset, and just really in keeping them engaged in that active listening skill too, to be like, can we talk about this? I'm your doctor. I'm here to keep you safe. I'm here to keep you healthy, and really keep that communication going between the two of you. The first step, though, is always to remind them that not using is the safest option. But I think many of our teens, I don't know if any of you can relate to this, but I've definitely had teens that think if they share something with me, I'm going to like leave the room and call the police, right? And somehow like involve like different legal matters. And so reminding them, right, that like, I'm truly here for your health, right? And what we talk about is just going to stay between us unless, right, I'm really worried about your safety, I'm worried about your health, and then we need to get other trusted adults involved, but that rarely involves law enforcement. And so just reminding them of kind of what those confidential rules may be for your practice. And so, I think it can be helpful to really talk about like, hey, I'd like to talk about safer ways to use today. Are you open to talking about it with me? And so if they say yes, great. Okay, let's like start with some talking points regarding their current use, ways to keep them safe. If they thought about stopping, what would that feel like? And if they say no, sometimes that comes up. It may be helpful to try to come at it from like, what peers or friends might be helpful and not necessarily themselves. And so I think many times, right, if you've worked with a lot of, especially young adolescents, sometimes we'll talk about asking, hey, what do your friends at school use? Or, have you seen peers at your school vaping? Or, it kind of opens that discussion of what they're exposed to. And so somehow making it the other can make it less intimidating to talk about themselves. And so sometimes I'll come at it as, do you know what other people do to keep themselves safe while drinking, right? Or while vaping or using weed or other substances, or even coming at it from, can I share with you some things that I've shared with other people? Um, and so really just steering that conversation and trying to keep that door open. Oh, I'm so sorry. Many times though, they may be like, no, I don't want to talk about this. I have no concerns. This is not why I'm here today. I'm here for my sports physical, right? Because, right, it may be that they're worried about legal troubles. They may have a mistrust of us in the health setting. They don't think it's a big deal. And so sometimes sharing some of these phrases have been helpful for me. So, some of my patients have concerns they might do something when they're intoxicated or high that they might regret later. Or some of my patients worry that they can't remember what they have done. Sometimes they worry, about they've been in a car where maybe their friend was intoxicated while driving, or they've heard about fentanyl-laced products and they're worried about that, or that their friend might overdose. And so kind of identifying it as the other can sometimes continue to open that conversation, even if they're like, oh, I don't have concerns about myself. And so really kind of thinking about, that MI skill, right? Like what worries or concerns do you have when you use? What worries do you have if you see your friends use, right? And trying to kind of help them think through some of those scenarios. So this is where, I wanted to talk about some common substances that come up more commonly for adolescents and some risk reduction pieces and some strategies that you may or may not have heard of before. And so for alcohol, I always think about protective behavioral strategies. And so specifically, especially for like my young adults, right? My college age youth, right? We know that many colleges, I know it's that time of year for like college orientation, do a lot around talking about alcohol use and safety in those pieces, but really talking about, hey, when you go to a party, if alcohol is there, like how do you approach that, right? How do you keep yourself safe if you do choose to drink, right? How do you pace yourself? Really getting concrete with those pieces. How do you ensure you have a safe drive home? How do you ensure your friends stay safe? If you were worried about a friend, a peer at a party, do you know that it is always okay to call 911? It is always okay to ask for help, right? But really talking to them about some of those strategies so that they can keep themselves safe and their friends or colleagues safe, right? You may have heard about contract for life before, so that sometimes can be a helpful strategy to integrate into your practice. And really, we do a lot of focus on that kind of safe driving pieces if people have been acutely using, just because of the risks associated with DUIs and risk to themselves and risk to others. Some of the other ones that come up quite frequently in my adolescent practice is nicotine use. We know, right, especially like vaping that has significantly increased over the last few years. The good news is we are starting to see that level off, so I have some hope for the future. But acknowledging in Kentucky, we still have the people that are using combustible cigarettes, so always try saying kind of nicotine use. Some of you may be familiar, but with nicotine specifically, right? There are some now better guidelines out from the AAP around considering pharmacologic intervention for youth, especially if they're gosh, using nicotine of some sort multiple times a day throughout the day. And so we always rely on behavioral interventions, right? And trying to use other strategies for cutting down and going cold turkey. But for youth, especially they're using some of these vape products where the nicotine concentration is very high. I do think, especially if they're using throughout the day, they're having significant cravings upon waking, that is an opportunity to talk with them and their parent about nicotine replacement therapy, and that potential kind of pharmacologic piece. Important thing to remember is if you do have a 16 or 17-year-old that's been vaping pretty heavily, you're talking with them about nicotine replacement, whether that's, starting with a patch and some lozenges, right? Some gum. They do need a prescription for that. Technically, to get it over the counter, you do need to be 18 and older. And so I always like to kind of remind people of that. And for different kind of websites, I really like smokefree.gov has some great websites. And they actually have like a teen, like on the mobile device, some teen texting kind of like quit lines and some apps to use for distraction if they're having cravings and some of those pieces. So it can be a great jumping off point, even just resource for our patients. And then the most other common one that we're seeing is cannabis use. And so I did want to kind of share some strategies that I have, because I feel like this is one of the most common conversations in teen clinic is around cannabis. And so I always like to talk with my teens about really reflecting on like, oh, when did you start using? How often are you using? Like, all of those great pieces. But sometimes teens feel like, oh, it's not a problem. So I'm like, oh, when's the last time you took like a tea break, like a tolerance break? And that sometimes gets them thinking like, oh, actually, it's been a few months, right? And so then we can better engage and like, ooh, are you having cravings? Or like even sometimes I give them a challenge, like, what would it be like to not smoke for a week? Do you think you could do that? Right. Depending on the team, some of them are like, yeah, I could absolutely do it. Um, uh, and then I'll check back in with them and be like, how did that feel for you? Like, were you able to like go a few days, right? Like, what was your goal? Did you have cravings? And kind of like touching base about that. So sometimes that can be a good opportunity to even open up the conversation. I also wanted to kind of put out there, and now this is an off-label kind of use, and this is a supplement, but there is some data and some review papers. If anybody's interested, I'm always happy to share with you around N-acetylcysteine use and cannabis use disorder. Specifically, the data is stronger actually in young people. Usually the studies look at age like 16 to 21, but sometimes that could be actually helpful for decreasing cravings in some of the studies that look at even like placebo-controlled trials paired with therapy, in some studies paired with contingency management. But, thinking about any strategies that might be helpful in kind of cutting down their cravings and cutting down their use. So I did want to kind of put that out there. And again, happy to have that discussion offline for anybody that's interested. I also really want to talk a little bit about the recovery environment, right? So regardless of kind of what substances some of the adolescents and young people we may encounter might be using, I think it's important to consider the role of the family, right? And what that recovery environment looks like. And that's not a conversation we have a lot, at least in the pediatric realm, but in addiction medicine, right? In adults, we talk a lot about recovery environment. And so always thinking about like, okay, what is the family kind of structure or that home life look like for them, right? Caregivers can get really burned out, right? Just like any other chronic, illness or disease. And so ensuring caregivers are taking time for their own care. Is there a role, not just for individual therapy for our patients, but like, do the caregivers need some individual therapy support, right? Do we need family systems work happening in family therapy? And there are some resources for counseling and support group for caregivers. I think it's also an opportunity to even think about if our young people are struggling with different substances like is there an opportunity to talk to parents about what does kind of substance use look like in the home? Not that we need to be there, that mom or dad or that parent's like physician necessarily, but even thinking about like, hey, if your young person has struggled with binge drinking, had some really negative consequences, and we're sharing this message with them that like they should not be using, that it's not safe to use, it's not healthy to use, like is is this a time to talk with families about like what is it like, do you have alcohol in your home, do they see you drinking and then you're telling them not to drink and they feel like it's a double standard, right? Many of our teens, right, we're always like, do what I say and not what I do, right? We do a little finger wagging at teens. And so really having that conversation with families who are open to it can sometimes be helpful. Or even if they have struggled with different polysubstance use and they're coming back into the home environment, maybe they've been at a residential treatment facility, really talking about what is their access to substances, right? Like we should try to really eliminate that like within the home environment as much as we can. And that's not always something that's at the top of our mind, right? And necessarily with the patient in front of us. And so this really goes back to kind of supporting families, right? And so I did want to spend a little bit of time today talking about some practical advice on setting boundaries and creating that supportive home environment. And so this really goes back to like, as we were just talking about that recovery environment and like what type of modeling are we doing at home, right? What is that access to substances looking like? Whether it's alcohol, tobacco, other substances, cannabis, and what are the rules for home, right? I think many times parents and caregivers forget the things that they do have control of in their teen's life, right? And how we can leverage various privileges at home. And so I want to talk a little bit about the 5 C's today and some strategies I use in my clinic. I will always preface, I know they love to ask on like PEDS boards, for example, or different like testing environments, but sometimes it comes up, right? That we have parents coming in with their teen and the mom is like, I want to talk to you, before the visit or whatever. And they may be asking us to like do some urine drug testing on their teen, but they don't want to talk to their teen about it. And we all know the board answer is like, no, like don't do that. But I think it's helpful to talk about like in practicalities, like, hey, like what are you worried about? Tell me more, mom or dad, right? Like, have you had this conversation with your teen? And really bring the teen into that conversation, like, hey, your parents are worried about XYZ. Let's like talk about it today, and trying to, our role, right, is always try to support that family environment when we can. The 5 C's that we're going to talk about, these are strategies if maybe like there's already been some substance use, right? And the parents are like, I don't know what to do. And these can be used in addition to some of the other, resources when we think about therapy supports, when we think about different, psychiatric supports, substance use counseling, some of those pieces, but just strategies for reinforcing the behaviors we do want to see at home. So the 5 C's. So the first one is cash. So I always think about cash flow, right? So many teens, I mean, some teens do have their own like part-time job and whatnot, but many teens, they are not like totally self-sufficient, right? They're living kind of in the family environment. And so thinking about, if they're out purchasing substances, how are they doing so, right? And so talking with the family about, hey, okay, how can we like remove, some of that like purchasing power, right? Like we're not just giving them, oh, here's $20 for lunch at school this week, right? But maybe we can give them a small denomination like gift cards or work out, a school lunch kind of fund with the school, right? Any no ATM cards where they can just like go withdraw money. But if maybe it's like, okay, you need to get gas this week, we have a joint credit card. I can look at the credit card and see exactly where it's being used and what it's being used for, and that I need a receipt for all purchases, right? As a way to rebuild trust that that money is not being spent on substances. I always, I'm sorry, I feel like I've talked a lot about cars and car safety and driving safety today, but we know it's such a risk to our youth, thinking about what does that car safety look like? Many times, we think, oh, they have a vehicle, they're 16, 17, they, drive themselves to school and extracurriculars and whatnot. But really, like if there is any concerning substance use happening, that is a huge area to leverage like parents with too. And this clearly always involves like the parents being aware of kind of what's going on. We're really talking about no car privileges while using substances, right? We can, if they're using a car, it can only, be in the daytime. It can only drive to like certain appointments or school, right? And this is also an opportunity to do, typically this happens more in the outpatient recovery environment, but where there's a written contract for teens and families around some random urine drug screening, right? To ensure that they're not going back to use and then getting in the car where they're putting themselves and others at risk. Email cell phones, right? Cell phones dominate so much of our lives. But does this mean that they don't need a phone at all, right? Or maybe they have one of these like dummy phones, where they don't get certain like data or certain Wi-Fi access. I don't know if you guys are aware, but the Nokia brick is making a comeback, right? The old school like Nokia phones, and the Razor, which was very cool when I was in high school, is making a comeback, right? But just thinking about how we can really restrict phone usage. We know that some teens are accessing substances via Instagram, via Snapchat, via other social media platforms. Not to call out anybody in specific, but you're really thinking about how we can put some of those protections on, right? Because many times it's not teens that are necessarily paying for their cell phone, right? That is still under the power of their family structure and their parents or guardian. Thinking about how we can limit their Wi-Fi access. And so different internet providers will allow you to choose certain devices and set schedules and let those devices, at a certain time, Wi-Fi turns off. How can we think about that piece? I know it's becoming more and more popular now. I feel like in the last few weeks with back to school is really limiting phone access in schools and thinking about devices have to be, in a shared space or in the parent's bedroom at nighttime, GPS location tracking, but just thinking about how we can really use these strategies to rebuild trust among kind of parent and child, right? To say, okay, right, like how we can reintroduce independence, but really kind of eliminate risks that might be happening as much as we can. Computer access. So this is using some of those same strategies we talked about: limited duration of Wi-Fi access and password protection, limiting where those computers are. How can we be using different technology and different platforms to look at their web browsing and try to limit, like if we're worried about live gaming that's happening or limited gaming, and that this is really restricted to like educational purposes. The other thing is curfew. I think setting clear expectations among teens can sometimes be helpful. So, hey, if you're going to go out with your friends, this is what time you have to be home at, right? Clear bedtime expectations, a lights off time. And sometimes it can even be helpful before you start getting into all of these really nitty gritty things, like even asking about what are the rules for home. And sometimes it can be surprising that you'd be like, oh, there's not clear rules for home, but there's a lot of conflict. And so, thinking about like, well, maybe we should set some rules, even if we're not to a place of using really risky substances, right? But even for like my like middle age or middle school age teens, right? My younger high school teens, like, what are the rules for home, right? Because maybe that's an opportunity to try to eliminate conflict by just like setting some expectations, right? And really having some clear boundaries, and thinking about how we can reinforce, some of these different pieces. The last thing I really want to talk about too is like referral to treatment and some community resources. And you all are probably really familiar with places like the Brook, Peace Hospital, Seven Counties have some different programs in place for adolescents that are you have risky substance use and especially do meet criteria for substance use disorder, or you're really worried about it, you're on the fence. And so these programs do have different residential options in addition to kind of some kind of more intensive outpatient programming. So I think that's always helpful to keep in mind. And then I did want to highlight too, findhelpnow.org can be a great place to kind of start if you're trying to connect families with kind of some resources and treatment. And this is actually quite nice because you can look by like the age of the patient, what type of maybe insurance they accept, what types of treatment, and like your location. And so I've tested it out a little bit and found that this looks at places across the state of Kentucky. And so quite helpful depending on your practice environment. And then the last piece I really wanted to highlight is really thinking about the psychiatric aspect, right? Acknowledging, right, that many teens do have co-occurring psychiatric conditions. Um, and that's really important for us to address that in addition to the substance use that might be happening, right? Um, and so we know that there are some different like correlates of substance use disorder. And so some of the major ones we think about are co-occurring major depression, generalized anxiety disorder, and PTSD. And we think, especially when these things aren't being addressed, it's a bit of that lack of support for this heart unburdening, right? They don't know how to get these things off their chest. They are just trying to cope, that they go down these kind of other strategies to try to cope, including substances. And that sometimes, right, they may use, again, like I highlighted, they're anxious all the time. They feel like they can't sleep at night. Feel like they have insomnia. They're bored, right? And we also know there's a risk for individuals that have had high ACEs or adverse childhood events, or some recent really negative life events that have occurred for them. And so, some of the most important things we can do is really thinking about how we connect them to appropriate like mental health therapy supports and psychiatry if they need it. And so therapy is really the primary treatment modality for teens with substance use disorders. And so, the most effective strategies we found are really actually in therapies that also can involve the family system to a point, right? And really encouraging that positive recovery environment. And sometimes, right, we do need that individual therapy around contingency management, CBT, PTSD treatment, depending on what their risks might be. And one thing I always like to encourage is actually really a lot of pro-social activities for my teens, right? We talked about like boredom can be a risk. And so what are we doing to like support that just pro-social development that happens for teens? And so like, do they have certain hobbies they like, exercise, extracurriculars, sports teams, what are those reasons not to use putting them in an environment where other peers are not using, right? And really giving them something else to spend their time on rather than substances. And then I think, this is always an opportunity to have that discussion around, hey, like you're using cannabis all the time because you are super anxious. Like maybe like we should talk about SSRIs, right? We should target your anxiety to better kind of uh, address the underlying problem and get you in therapy rather than like relying on cannabis, because one thing I think I hear a lot from teens is like, oh, it's just weed, right? Oh, it's just a little marijuana. And but I think most of us are aware, right, that like cannabis nowadays is much more potent. The THC component is much more potent than it was years ago. And with such high levels of THC, it actually does in the long term make things like depression worse, can worsen anxiety, right? And so if we're really using that as our coping, strategy, sometimes it's helpful to be like, okay, well, where do you see yourself in like 5 years, right? Or 10 years? Like, is this still going to be part of your life, right? And really kind of trying to put some perspective on it with the young person. And then I did want to share a little bit about kind of craft. And so this is kind of one of the craft books. So I just wanted to kind of put that out there. Um, that can be helpful for families and parents and caregivers. And so craft is really, it's different than the craft schools. Like it's confusing a lot. But this craft there's only one F. And it stands for community reinforcement and family training. And so this can be a good model for families, because really the research has demonstrated that understanding kind of what motivates their young person or the person in their family that is using substances, they can induce positive change. And that it does show that it has higher rates of positive outcomes as compared to just intervention or 12-step programs, because really it's aimed at trying to encourage those healthy, constructive changes and focus on helping, your child redevelop a life. And it's more of a behavioral approach, and not just kind of talking at them, but trying to really involve them. So I did kind of want to just share that piece. And there's a resource here around kind of parenting toward recovery, their website does have some resources as well. And if you search craft for different families, and there's some different kind of therapists out there that are experienced with craft. But it can be an opportunity to even just getting young people or people in general that are using into treatment by really trying to support their caregivers and supporting them. Oh, so that's that's a lot, but hopefully a little bit of some ideas and some strategies for kind of working with youth and really just talking with parents about some things that they might be able to identify to incentivize young people not to use acronym. And I am a resource, and if anybody ever wants to discuss a case offline or just thinking about where to get young people connected, I'm always here to support you all. Yeah, thanks.
Well, thank you, Dr. Bell. That was terrific. And I also appreciate your courage putting your email up there. That is very good. So if anybody has questions, please put those into the Q&A section. And while you do that, I just have a couple questions that I pulled off here. I'm almost afraid to ask the first one. I know these are important discussions. Is there a particular age that you think we need to start?
That's a great question. So I think it's always appropriate to start asking teens about substance use. Um, starting at that middle school age group, so 12, 13-year-olds. And I think, it's a different conversation. They have a 12 and 13-year-old, right? Than like a 17 or 18-year-old. So even just remembering that, right? That, you can lead with like, oh, hey, like some of my, other patients have told me that at school they see people vaping or, maybe they've been offered alcohol. Like, what's been your experience, right? And just trying to like use that like peer leverage piece to see what they share with you, and just kind of build in from there. Because we do know that we have young adolescents that may be vaping regularly, smoking cannabis, and so I think, if sometimes I'm not sure, right? Like, where is this young person? So I may lean on like asking about the school environment or peers. And then if they share, like, oh, yeah, and be like, oh, have you ever tried, and kind of open that conversation. Because I do think we always want to try to catch them as early as possible.
So this is a question coming from a non-pediatrician, so it may not be a terribly good question, but I'm curious how the parents are handled in all of this. If 13-year-old comes into the office with their parent, do you ask the parent to leave, or how do you manage it?
Oh, that's a great question. Yeah, I should have led with
It was
that.
probably obvious to a pediatrician, but not obvious to me.
No, it's a great question. So I tend to have these discussions during my independent time with teens, right? And so for those of you not as familiar in the pediatric model, that is always the gold standard, even if we don't always have time for a really lengthy discussion one-on-one with teens. So it's where I really leverage some of these screening tools, right? Where, after my initial HPI and be like, hey, I want to give the teens some independent time today to like ask questions about their health. And that's what I'll dive into, like, oh, hey, like I saw on the craft, you circled all these things. Let's talk about it. Because I do think it's really important to establish that trust. And try to use that like very short amount of time we have with teens in the most high yield way possible, right? So I would just highlight that, right? Like we all in peds, we know we should do this like really lengthy, like social history taking of like everything from their home life to like school to like substances and sexual activity. But sometimes, right, we have to like use our screeners and be like, this is what we really need to address today, right? And prioritize. And that is okay.
I completely understand the limited time. That part I understand. Do you get pushback from the parents, or is this just very well accepted?
Yeah, I think every family is a little bit different. And so of course, right, like I think those of us working with teens and trying to do some one-on-one time have experienced pushback. And so if parents really are uncomfortable, right, and teen wants them to stay, like absolutely, right. I still think it's appropriate to be like, okay, well, these are the things like I was going to ask, right, and have that conversation. But many times I think most most parents are like, oh yeah, like you fix them, bye, like running out of the room. I always do like to preface my confidentiality statement before parents try to like run out of the room, and just
Yeah.
saying like, hey, what we talk about stays between us unless I'm worried about your young person. If I'm worried about their safety, I will of course involve like other adults, including you potentially, right? Like, I want to let them know, like if I was super worried about their kid, I'm not going to let them leave that day
Yeah.
without saying
Yeah.
something.
Yeah.
So
Well,
usually that helps.
in fairness, I do think I recall reaching a point where we simply drove the kid to the appointment and didn't go back with them from the parent side. So that
Right, right. Or
probably
they're
was
like,
not a bad
bye.
way to do it. Yes.
Yeah.
So, just one other question. You talked about setting the SMART goals, and so I
Mhm.
understand that. Uh, is there a certain time point that you have in your mind where when they come back to review those goals?
Yeah. So I always think, it's like a case by case basis, right? And I want to be really clear, right? Like if somebody told me that they had been experimenting with like unknown pills
Yeah.
from their friend, right? I always assume, honestly, I assume that that probably has fentanyl in it, right? Many things on
Hmm.
the street do.
Yeah.
That is always like a red flag to me, like, let me go get your mama. Like, we're going to have a discussion. Um, but if it's something around, and even when parents do know about like their cannabis use, right, their nicotine use, I'm always like, hey, can we like check in a few weeks? Like maybe it's 4 weeks, maybe it's not very often, right? Maybe they're coming back in 3 months for other follow-up stuff too. Like, hey, I'm gonna write that in my note. We're gonna like, you set this goal today. I'm gonna check in with you about it. Um, but I do, especially for my kids, I'm really worried about their level of like cannabis use. I'm like, okay, you're gonna come and see me in a few weeks, and you told me today you were confident and you could stop anytime, and you're gonna take a week off.
Yeah.
We'll see how it goes.
Yeah.
Prove me wrong. Teens
Yeah.
sometimes like that, they're like, oh, I'll prove you wrong. And sometimes they do it, right? And you're like, oh, that's great. How did that feel? And then sometimes they're like, oh, that was actually really hard. And you're like, yeah, maybe we should talk about this more.
Yeah. That makes a lot of sense.
Yeah.
Um, well, I think those are all of our questions for now. If there are any others, people can type them in. But otherwise, I obviously thank you, Dr. Badal. That was absolutely terrific presentation.